Okay, so good evening everyone. Today we will be discussing about the scholarship test of the Osh Mahotsav 3.0, which was on the subject of PSM and surgery. Okay, na? So the first question is about surgery. 50-year-old woman with who present after the thyroidectomy came for the second opinion after the treatment of papillary carcinoma thyroid. What would you recommend? So if you know papillary carcinoma thyroid, it can metastasize to the lymph node. So since she has already underwent thyroidectomy, what will be the recommendation we will give? So first, radiotherapy. Yes, we can give radiotherapy, but we need to check the local invasion or invasion to the lymph node or any remaining tissue of thyroid. If it is present, we will give. But how we will know? First, we will do the radioiodine scan. Whenever we will do radioiodine scan, we will get to know about the local invasion or any remaining thyroid tissue present in the body. Chemotherapy generally we will not recommend. Why? Because this is recommended for undifferentiated thyroid cancers. Okay na? So since papillary carcinoma thyroid is a well differentiated cancer, so we will not recommend. Wait and watch can also be there, but if she has undergone thyroidectomy, we need to plan the future diagnosis or imaging and the treatment. So for that, best option will be first we will do radio scan. If any tissue is present, then we will do radiotherapy. If any tissue is not there, then we can move forward with the wait and watch. So the correct answer will be radioiodine scan. Second question is also related to surgery, that whom you will consider BRCA1 and BRCA2 genetic testing. Okay na? So first option is breast cancer diagnosed in postmenopausal female more than 50 years. Second, male breast cancer. Third, bilateral breast cancer. Fourth, breast and ovarian cancer. So here you can see I have included the table for BRCA1, BRCA2 testing. So here you can see the family member with non-BRCA1, BRCA2 mutation, you will do BRCA1, BRCA2 testing. Second, any personal history of breast cancer. It can be below the age of 45. It can be less than 45 with one relative affected who is also less than 50-year-olds. Any two primary breast cancers. Onset of age if more than 2 or equal to 2 close relatives with breast or ovarian cancer. Anyone with triple negative cancer age less than 60, and any Ashkenazi or high risk ethnicity patient. So the personal history, anyone who is having less than 45 age or their relative are affected, personal history of ovarian cancer, personal history of male breast cancer, and close family members meeting the above criteria. In all these patients, we will do BRCA1 and BRCA2 genetic testing. So here you can see male breast cancer, yes, it is the indication. Bilateral breast cancer, it is the indication. Breast and ovarian cancer, it will be the indication. But any female who is in the postmenopausal female more than 50 years, this is not the indication. So this is the correct answer, because we need to search for the except means the wrong answer. So the wrong statement will be the A. So this is BRCA1 and BRCA2 genetic testing. Third question is also from surgery. It is saying there is a 51-year-old lady complain of mass in right breast. On examination, mass is larger than 5 cm. It has ipsilateral axillary mobile lymph node. What staging you will give? Okay na? So here is the TNM classification of breast cancer. So you can see there is full classification. So TX means primary tumor cannot be assessed. T0 means no evidence. TIS means carcinoma in situ. T1 when it is less than 2 cm. Okay na? T1A 0.1 to 0.5. You can read this. T1B, T1C. Then we have T2. T2 is more than 2 cm and less than 5 cm. T3 is more than 5 cm. T4 any size with direct extension into chest wall, skin or only as described below. Like T4A is going to the chest wall, T4B associated with either edema or ulceration or any satellite skin nodules into the same breast. T4C, both T4A and T4B, and T4D is inflammatory carcinoma. Okay, so here you can see the mass is larger than 5 centimeter. So according to the classification, it will be T3. Then he is having ipsilateral mobile lymph node. So now N classification, you can see NX, no regional lymph node is involved. N0, no regional lymph node is involved. N1, metastasis to mobile ipsilateral axillary node. N2 ipsilateral axillary lymph node which are fixed to one or other structure. N3 is metastasis to ipsilateral internal mammillary lymph node. Okay na, so the status will be N1. Since it doesn't show any metastasis, so M status will be 0. So correct answer will be T3 N1 M0. Now we have two options with the same. First one is T3 N1 M0 with the C, T3 N1 M0 by. Okay na, so for breast cancer staging we have few suffix like C, we are using C, we are using P, we are using R, we are using Y, M and A. Okay na, so it can be CTNM, PTNM, RTNM, YTNM, MTNM or ATNM. A means it is a C means it is a clinical staging. P means it is a pathological staging. Okay na. R means recurrent. Y means it is after or post neoadjuvant. Okay na. Post neoadjuvant. M means multifocal tumor. And A means in the autopsy. Okay na. So here this female, they didn't mention that she underwent any type of chemotherapy or neoadjuvant therapy. So the correct answer will be A, C, T3 N1 M0 because we are checking it. So it is a clinical staging, not the Y staging. So this is about breast cancer staging. Next the question is related to breast conservative surgeries. Okay na, so for breast conservative surgeries you need to check what are the contraindications except. Okay na, so which is not the contraindication. So for breast cancer surgeries or breast conservative surgeries, you need to know that the indication of breast conservative surgeries are: first one, tumor less than 4 centimeter. Second, tumor has to be a single tumor. Okay na, it cannot be multifocal or multicentric. Third one is no lymph node involvement. Okay na, if these three are present, this is the indication of breast conservative surgery. So all four are contraindication, but these three, tumor more than 4 centimeter, multicentric tumor and axillary lymph node involvement, these are the absolute contraindication. And the last one, diffuse, is relative contraindication. Okay, so this is a relative contraindication. So sometimes in diffuse microcalcification, when they are associated with DCIS, means ductal carcinoma in situ, we can prefer breast conservative surgery. Or maybe all these calcification are present in the same area, we can remove them. So breast conservative surgery is absolutely contraindicated in the tumor more than 4 centimeter, multicentric tumor and axillary lymph node involvement. But it is relatively contraindicated, that's why the correct answer will be diffuse microcalcification. Next question is related to esophagus. So esophageal endoscopy reveals serpiginous ulcers. What is the this finding, what it indicates? Okay na, so the correct answer is CMV. Okay na, because cytomegalovirus will cause deep serpiginous ulcer into the esophagus. Okay na, so here you can see this is the esophageal endoscopy, and this area, this is a deep ulcer, this is for cytomegalovirus. Here you can see in this diagram, here you can see small punched out lesion. Okay na, small punched out lesions. These are more commonly seen with herpes simplex virus esophagitis. And in the below image, here you can see these white patches. These are more commonly related with candida esophagitis. So this is how you can identify all three types of esophagitis. So cytomegalovirus is the correct answer. Cytomegalovirus will show deep serpiginous ulcer. Candida will show white plaque into the esophagus. Herpetic ulcer will be small punched out, and radiation ulcers are very non-specific. They are superficial non-specific ulcers. So this is for esophageal endoscopy. Next question is related to stomach. So proximal dislocation of squamocolumnar junction is seen in following condition. So first option is eclasia cardia, second is sliding hiatal hernia, rolling hiatal hernia, or GRD. So in this, correct answer is sliding hiatal hernia. So hiatal hernia is of three types mainly. Type 1 is sliding, type 2 is rolling, and type 3 is mixed. So in the image you can see this white dot is showing us gastroesophageal junction, which is also known as squamocolumnar junction. So in here sliding hernia, this junction is above the, or it is present in the chest. Okay, so that's why this will lead to the proximal dislocation of the junction. In rolling hernia, you can see the junction is present below the diaphragm, but the stomach can be seen in the chest, and in mixed it can be present in chest also. So here we don't have mixed option, so the correct answer will be sliding hiatal hernia. Next is hose pipe appearance is of intestine is a feature of. So the correct answer is it is a feature of Crohn's disease. Okay na? So whenever you will do CECT, you will find hose pipe appearance, that is for Crohn's disease. But in ulcerative colitis, you will find lead pipe appearance. Okay na? Why these are occurring? So in Crohn's disease, it is because of chronic inflammation and fibrosis, which will lead to the thickening of bowel wall and narrowing of the lumen, which will in turn lead to the loss of flexibility and elasticity of the lumen. That's why it will appear like a hose pipe appearance, and it more commonly involve small intestine. What are the other feature you will see with the Crohn's disease? So you will see string sign. You can also see cobblestone appearance. You can also see skip lesions, and you can also find fistula and abscesses. Okay, malabsorption will not show anything like hose pipe appearance. Malabsorption syndrome will have a mucosal atrophy, okay na, and villus flattening. So all the villi will be flattened. So this is the characteristic feature for malabsorption syndrome. Next is ulcerative colitis. Ulcerative colitis more commonly affected colon. It will show lead pipe appearance. This lead pipe appearance means there is loss of hostration. Okay na? So whenever in large intestine hostrations are lost, it is called as lead pipe appearance. Okay, Hirschsprung disease, it is a congenital disorder. Okay na? In this condition, you will see that this proximal bowel is dilated. Proximal part is dilated and distal part is contracted. Okay na? And where you will have deficiency of ganglia, so here ganglia are absent. That's why this part is not able to relax, so proximal part will be dilated. So hose pipe appearance you will see in the in patients of Crohn's disease. Next is, which of the following statement is false regarding rectal carcinoma? So far We need to check which is the false. So we will read one by one option. So first is Hartmann's operation is done in elderly debilitating patient. This option is correct. Okay na? So what is Hartmann's operation or Hartmann's procedure? Wherever we have carcinoma, we will do resection of that part and we will close the rectal stump. Okay na? And and also we will do colestomy. Okay na? So here you can see we have closed the rectal stump. This part of the rectosigmoid colon we have removed and we have made an stoma, and stoma, that is colestomy. So this is true in elderly debilitating patient because we cannot prefer any large surgery. Second statement is adenocarcinoma is rare variant of rectal carcinoma. This statement is wrong. Why it is wrong? Because it is the most common. Okay na? So adenocarcinoma is the most common type of rectal carcinoma. Okay na? So you need to remember what is the most common variant of rectal carcinoma, that is adenocarcinoma. Third one is the patient will have in early morning spurious diarrhea and tenesmus. Yes, so spurious diarrhea means in early morning they will pass only small amount of urine, small amount of feces along with mucus, and tenesmus means they have contraction and they always feel something, or they always feel that some amount of stool remaining in the rectum. So incomplete evacuation they will feel. Okay, so this is also true in cases of rectal carcinoma because the tumor is in the rectum, that's why they will feel that there is incomplete evacuation, and because of that they passes a small amount of feces along with lot of mucus. Fourth option is they are growth confined to the rectal mucosa is stage A of modified Duke's staging. This is also true. So there is staging system of Dukes. Okay, modified staging system of Dukes. They have given four stages A, B, C and D. A tells us that tumor is confined to mucosa and submucosa. B tells us that it invades muscularis propria or beyond. Okay na? So it reaches muscularis propria or beyond, but without any lymph node involvement. Okay na? So no lymph node will be involved. C means regional lymph nodes are involved, and D means there is distant metastasis. So fourth option is also true related to the rectal carcinoma. So in this cases correct answer will be adenocarcinoma is a rare variant, because we need to search for the false statement regarding the rectal carcinoma. So the correct answer will be B. Thank you very much, and if you have any doubt, please do comment. We will reach out to you. And if you like this discussion, please like, share and subscribe. Thank you.